there has been a massive shift in the competition ratios for specialty training in the UK just over a short period of time. As at last year, the competition ratios were high and various quarters, colleges, the BMA, everybody kept talking about how the competition ratio has significantly increased over the past 5 years. However, just between last year, 2024 and 2025, there has been an overwhelming rise in the competition ratio, especially for some specialties. Okay, so in this video today, I'm going to be talking about the 2025 competition ratio for specialty training. I'm going to be talking about why are we having these figures, and also making some speculations about the possible changes that might eventually happen to the whole process of getting into specialty training in the UK. And I think this is very important, especially for IMG doctors who are both within and outside of the UK, especially for those outside of the UK. So if you are in that category, then you probably want to listen as I go ahead in this video to this. Hello, my name is Blessing and I'm a doctor practicing here in the UK. So if today is your first time here on this channel, I want to say you're welcome. Thank you so much for your support so far, for all the returning subscribers. Okay, so let's just get into the discussion of today without wasting any further time. Okay, so I'm going to be talking about, I'm going to be mentioning some figures. So it was said that in 2025 alone, over 91,000 applications came in for specialty training, and there are just about 12,833 posts, and then over 91,000 applied for this specialty training. Now, keep in mind that out of these applications, there are some candidates who apply to 3, 4, 5 specialties. So at the end of the day, it's possible that it's not just over 91,000 candidates, but even if it's not up to 91,000, that is still a massive number compared to the available training slots. So as of last year, it was said that the competition ratio was about, generally comparing the applications, the number of applications to the number of spaces, training posts available, it was said to be about 4.7, but that number has increased significantly to over 7, about 7.17 in 2025, just in a period of a year, and that is significant, really. But then for some specialties, it seemed to be worse, like psychiatry. Now, let's go back a little bit. Psychiatry used to be that specialty where a lot of doctors do not have interest, years ago, and that was why they had to do a lot of things to attract doctors to psychiatry. However, I think about 3-4 years ago, when the portfolio pathway was taken off, the psychiatry training application, then since then there has been a massive increase in the number of doctors applying into specialty training. Now that has worsened over the last 2 years. For GP and psychiatry, it is expected that there will be a very high competition ratio, and that is because these are the two specialties that are easy for IMG doctors who are outside of the UK to be able to apply into, because it doesn't require a portfolio. So it means that every Tom, Dick, and Harry, everybody at all can apply for psychiatry and GP, unlike some other specialties where the portfolio pathway is very important. So it means that you definitely need to have built your portfolio to an extent in order to be able to apply for those specialties. But even in those specialties, 2025 has witnessed a massive increase, like the IMT, the internal medicine training. The Royal College of Physicians had to release a statement sometimes last year with regards to the competition ratio for 2024, and I'm sure that now in 2025 that figure has gone even higher. So it's a lot of concern, and just a few days ago the Royal College of Psychiatry also released a statement with sharing their concern about the massive competition ratio, because how on earth will psychiatry have a competition ratio of 22-1? That is the highest so far. That means that for every one post in psychiatry, there are 22 applications for that one post. That is massive. And just last year, 2024, the competition ratio was just 10 to 1, and the college was still sharing their concern about the fact that this figure has increased significantly to what it used to be in the previous year. And just between 2024 and 2025, in short, 2025 has not even ended, and the figure had gone from 10 to 1 to about 22 to 1. That is more than 100%. Yeah, that's over 200% rise in the competition ratio. That is actually significant. Now for GP applications too, it's been the same, because it was said that over 15,000 applications were made for about 1,678 posts. So okay, that's crazy. Various quarters, various colleges have shared their concern about what exactly is going on and their fear about the future of medical training in the UK, like in the coming years. Okay, so why exactly are we having this increasing figures? Number one is because we can't put aside the fact that the number of doctors applying for specialty training has significantly increased over the past few years. So it means that there has been a significant increase in the number of doctors, but not enough change has happened in terms of the available roles to accommodate this increasing number of doctors. For example, the undergraduate medical posts have been increased, so the number of medical graduates per year has been on the increase over the last 3 years. No significant increase has happened in terms of specialty training posts to be able to accommodate this number of medical graduates who are getting into the pathway, the F1 program, the foundation programs, and then into the specialty training program. Now, the second reason is that there has been a massive increase in the number of foreign trained and international medical graduates applying for training positions in the UK. And this is being reflected in those specialties, especially where portfolio is not required, which is psychiatry and GP. There are some other specialties that IMGs are able to get in, but these are like the two major ones that are quite easier for IMG doctors outside of the UK to be able to get into. Now, for IMG doctors within the UK, they are able to get into almost any specialty if they are able to build their portfolio well enough to be able to qualify for those posts. Both for IMG doctors within and outside of the UK, there has also been an increase in the number of doctors considering training pathways. In previous years, IMG doctors do not quickly jump into the training pathway, but I think over the past 1 or 2 years, a lot of doctors have considered, a lot of IMG doctors especially, have considered getting into training pathways due to so many other reasons. There are so many other benefits that comes with being a doctor in training than being in a non-training role, and I think that has made it quite attractive to even IMG doctors within the UK. Is being said that one of the reasons for limited spaces is because the government has the duty to actually increase training posts. The current government has promised to expand specialty training posts over the coming years. That was clearly stated in the 10 years plan for England, and so that is quite hopeful for a lot of doctors who are considering the specialty training pathway. Is this expansion going to make a lot of difference? I think it will definitely make a lot of difference, and also with the current plan to prioritize UK medical graduates, when that pushes through and with the expansion, all of this should be sorted out in a few years. My speculations. Now, it is not just the competition ratios are not just figures for us to be aware. It is also part of the metrics that the planning, the workforce planning, the various colleges and all the people involved in education, medical education also consider. Because if various colleges are beginning to share their concern about how this could impact on the future of medical training and the future and career of a whole lot of doctors who are currently whether training or in the foundation program, if these issues are not addressed, because a lot of doctors who want to train are not able to get into specialty training. So it calls for attention, really. And so I think with the current figures in terms of the competition ratio, it's probably going to trigger some changes. Yeah, and one of the changes I speculate is that one is that they are going to make the specialty training process even a bit tougher, such that a it will not be very easy to get into specialty training, especially for some specialties where it is considered to be easy. For example, I am speculating that the portfolio system might be reinstated by the College of Psychiatry, and that is to discourage a lot of doctors who are outside of the UK to be able to apply for psychiatry. So that way, because of the portfolio, and in a way, you need to be in the UK to be able to build a portfolio. Now, if that is done, it means that it's going to reduce the number of doctors who are going to be applying for psychiatry training posts, because it will require those who are able to build their portfolio to meet the portfolio requirement to apply, that will be able to come in for those specialty training posts. I don't know if the GP might also consider doing that. Then also we can see that the government too is progressive. They have also talked about all of this in the 10 years plan for England. They plan to expand specialty training posts. Recently, the BMA had a meeting with the health secretary asking about time frame for the prioritization of medical graduates to commence. And as it is right now, there is no definite time that has been given. However, it is something that is being considered. I think that with this current competition ratio, there will probably be need to fast track that process such that the prioritization of medical graduates is going to take effect as soon as possible. If you are an IMG doctor in the UK, yes, build your portfolio, go on with your job, and hopefully, if the BMA is able to get the government to agree with the grandfathering plan, then it means that it will be easier for IMG doctors who are in the UK and have had up to 2 years of NHS experience to be able to get into training even after the prioritization of medical graduates has commenced. But before that happens, it means that there is still opportunity for IMG doctors both within and outside of the UK to be able to apply for specialty training. So I would say let's keep an open mind, but keep preparing for your exams, keep doing everything that you need to do, but somewhere just know that things might change. They might reel out some changes soonest because of all of these things. I'm just trying to say that whilst you are preparing for your exams, doing everything that you should do, just also keep your mind open that some changes might come into place at any time. Yes, anything could happen at any time, so nothing is guaranteed. However, I will still want to say that if you have not started the UK pathway, or maybe you are still like at the very early phase where you can still let go of whatever you have done, I would advise that it's probably better. You might want to reconsider your options, really, because I am not I don't think I'm in a position to advise you, but I would suggest that you want to consider maybe boycotting UK pathway and consider some other pathways, because a lot is happening in the UK right now that is making immigration very unattractive. And maybe for now, doctors, health workers may be covered, but in the future, we are not sure what is going to happen. So I would still advise that if it's possible, as an IMG doctor outside of the UK, you want to, and you are just about starting this process, please consider some other countries that are more open to foreign trained doctors. But we don't know what is going to happen in the coming months, coming years. The whole anti-immigration drama happening in the UK right now, even doctors and healthcare workers are leaving the UK to some other countries. I mean, people who have been in the UK, who have worked for some years in the UK, are leaving the UK to pursue their career in some other countries. So I think you might really want to consider your options before taking a step towards coming to the UK. I know that the PLAB posts are still open and a lot of people are still applying for those exams because they think, okay, it's one of the ways to get into the UK system. But I don't think the PLAB exams are going to stop anytime soon. But I think it's the doctors who we have to make the choice whether or not to sit for those exams before deciding if UK is where you really want to invest your time, your effort, and your future into. Okay, so this is where I'm going to be ending this video today, and till I see you again, take care. Bye.